straight. I tell you what.
All right, so we can adjust the L5. It's subluxated, meaning it's restricted. And basically put the patient on side posture. What is your pain, my man?
My lower back.
Okay. Can I have you interlock your fingers for me?
Okay.
Just kind of hold still for me.
All right.
You might want to actually maybe get it from this side. Just kind of hold it.
Woo, shit.
How does it feel, man?
That's great. Oh, Lord.
You're just gonna hold it for a second.
Are you getting good?
That's great. Oh,
See if you actually can stand up, man.
man.
How was the pain?
Less, way less. Yeah,
Way less,
I can
yeah.
stand straight.
Yeah, I wish we could have taped him when he first walked in.
Oh man, that's great.
That's awesome. That's your first time.
Man, yeah, that's the first time being adjusted.
Okay, that's great. So we'll do another follow up, when he's 100%. But I wanted to get it on tape because his response was good.